Welcome to the Long-Term Care Chronicles podcast. So in this episode, this is the second part of the Restoring Trust, COVID-19 and the Future of Long-Term Care with Dr. Sharon Straus from the University of Toronto. So let's have a listen. You talked about in terms of dementia as one of the populations, as well as, women over a certain age are primarily in long-term care, and we have other segments within the population that aren't necessarily older than 65. We do have, as you mentioned, the other congregate settings. We do have people that are special needs, developmentally delayed, that are living in long-term care, as well as individuals that, as I said, they're younger folks but have medically challenging needs. So I know the report talked primarily in terms of with dementia, but I guess how can that as well be seen, I guess, for, those types of other populations as well in there?
Absolutely. So it's a great point, and you're right. Like in our document, we really focused on the older adults, but you're absolutely right. What we've talked about here can apply to other congregate living settings, like whether they're group homes or other types of settings. It's the same factors that we have to think about. And you're right. Certainly, when you think about the long-term care setting, the residents, they do tend to be women. They do tend to be women who are at an economic disadvantage compared to counterparts. And again, I think it highlights. We talked at the beginning about the workforce, about it being having to use an intersectionality lens. I think we have to, that this is, again, I think one of the challenges that we have failed on is that we haven't taken that same lens when we've thought about the residents in long-term care and also in the other congregate settings that we've talked about. And so then our strategies to provide care then haven't necessarily been tailored to that. The staffing mix and model, the funding models haven't considered all those different factors. And so that's again why I think one of the challenges has been our failure to really have a thoughtful approach to making sure that we have a good understanding of the residents, their families needs, the residents' needs, our workforce needs, and who all these people are and what are their characteristics, and how do we need to make sure that what we're able to deliver in terms of care is tailored to them and their needs. And I think that's been one of the key things, because we don't, as we can't. It's not a one size fits all strategy.
Exactly. And then because you mentioned this varied population in long-term care, the training that needs to go in there, because we have nurse practitioners, registered nurses, registered practical nurses. We have PSWs or care aides, depending on what they're called across the country. And especially those PSWs and care aides, they don't have the training that can be able to really assist. It's all about task oriented, but that may not necessarily fit with the population. And I know the report did talk about in terms of making sure that is uniform across the country in terms of those type of standards. And that's why federally wise, this needs to be under the Health Act. So can you just speak to that, to some of those points?
Yeah, I think, again, you've raised a really important point, Wendy, that, part of the challenge is that, for example, you mentioned care aides or PSWs, like there isn't any, regulation. And so, so from province to province, kind of what happens in terms of education can vary from country to country. It varies. So it is something that, again, we need to think about what's optimal in terms of how much education, but also kind of on, as a clinician myself, we always talk about continuing education, continuing professional development. That's part of our that's part of the expectation. But what support do we give to these individuals to facilitate that, right?
Yeah.
I don't think we've developed a system to support their continued education and their continued professional development because they don't have that same type of an organization. And so being able to support that so that there is kind of ongoing education. And so during the outbreak, it's a great example of the appropriate use of PPE, just taking that one piece. It's not easy as you're starting to kind of use it, and over the course of the outbreak, the guidance changed over the way, along the way as well,
Yeah.
and so we're just keeping abreast of all the changes in the guidance from wearing a mask. Well, first of all, not wearing a mask, then wearing a mask, then mask and face shield.
Yeah. Yeah.
It changed, like it was changing, and I know how difficult it is to keep abreast of that. But then also when you're going into the rooms of people and you're, and the approach that you do, the donning and the doffing, and getting the training in that, and getting the reminders around that. Like one of the things that we found helpful on the acute care side of things was, like with our medical residents, we did like ongoing training with them. Like, we had ongoing training, and then we had basically safety officers who would go around and would do audits and would check, or we would have buddies that we would pair up with. And so it was implementing that same kind of an approach then in the long-term care homes, which did not have the resources to do that, right? So how do we do that? So how do we provide that ongoing education, and then having the ability to remind people as well, because as as we've seen as we're watching the news, people are getting pandemic fatigue, right? And we all get a little bit, we get a little bit complacent, and things, and so it's that constant reminder, that constant vigilance of what the processes are, and so you need to have that infrastructure and support, within the organizations to be able to do that, and to support the PSWs in being able to do that.
Yeah, absolutely. And hopefully that can be, the plan put out there to be able to have that facilitated. Because I know with some facilities, it all depends, because some will support that in terms of that additional education and others will not. And it all is, I guess you can say, not so much that I want to say that it's a recommendation or if it's an organization specific. It's usually each facility specific, if you know what I mean. Like let's say if it's company A, from company A, they have 12 facilities, maybe one or two are actually basing on their own initiative, what they feel is appropriate for their particular facility, that they'll go ahead and do that stuff.
Yeah. Well, I think that's an absolutely important point, because they're all managed by different people. So, so they're going to have different approaches. And certainly, I think that was very apparent during, as we all watched kind of the outbreaks that were happening at different sites. Like people have very different approaches, right?
Yes.
And so you could definitely, I think that's a critical thing that, even, across an entire network of homes, we may not have the same thing going on and may not have the same support across all the sites.
Exactly. And then now currently with what is happening in terms of a lot of long-term care homes currently, that there is outbreaks. And the recommendation did indicate that, the need to act is immediate, and we have not acted at this point in time. So, what will that, do to us and say to us about it as Canadians, as in our society, as to that we were fit, that we did not act, we did not try or attempt to even try to rectify and to implement something, because this pandemic will be with us for some time. It's at least, they're saying, I guess, 2 years at least. So we need to have some sort of a plan, but there's no action, no motion towards that. And then how can others get involved to be able to move that forward?
So absolutely. And I'm so glad that you asked that, because if we don't do something now, like, what is it going to take?
Yeah.
Like, what is it really going to take to affect change? And I think that's the thing that many of us find very, very distressing.
Yeah.
because we all have seen this happening, and to see this happen in Canada, it's I think it's tough for all of us to see, and to think that I agree with you. I don't think that we have effectively met the challenge yet for the next wave. Everybody is working really hard to do so, but ideally it would be nice to see some of these recommendations that we've talked about, like continuing the pandemic pay, for example. Recruiting more into the long-term care sector, making sure that that we really do have adequate PPE supply chains within the long-term care, adequate access to testing, and with the results getting made available to the workers in a timely fashion. So there's all these different pieces that we're already seeing there's struggles with it. Everybody's seeing that, and so I think that it has highlighted that now is the time. We have to act on this, and we have to move this forward. And I think it's a great time for advocacy, and I hope that the people who are listening to this, the family members, the other caregivers, really are vocal about the advocacy and engage on the messages on we want to provide the best possible environment for residents in long-term care homes. This is their home. They deserve a fantastic quality of life, a good end of life for those at that stage. They deserve that. And we should be valuing that, and we should be providing that for them. And we should be valuing the work that the frontline workers in the long-term care homes are delivering. This is the other piece that I really worry about, that these individuals have gone through a tremendous amount of stress and moral distress over this time period. And now, as we're heading into this next wave, are they getting the appropriate support, to go through this next period? And how best can we support them going through this next period? So absolutely, I agree with you that now is the time for people to be vocal. Ask about these recommendations. Ask about why pandemic pay can't be continued. It's variable across the provinces, and so thinking about how can we ensure that those messages are heard, and that again, we're not asking for lots and lots of new money with no accountability. We want to make sure that any funding that goes from the federal government to the provinces and territories is attached to high quality care. And by high quality care, it's what the residents and their families and the staff want to be achieved.
Exactly. Because that's what's really needed to be able to ensure that, whether currently and in the future, that quality of care and quality of death does happen within that segment. And then, because I know that the report as well mentioned in terms of the recommendations as to how to kind of correct or resolve the workforce issue, and how the provinces and the federal government should really be working collaboratively together to be able to do this. And can you just talk to some of the points that you mentioned in the report?
Yeah, so for sure. So part of this is around, we've talked about the funding, but also thinking about, setting up a national working group that would actually look at the appropriate staffing model and mix, and setting the standards. So what are the standards in terms of the amount of direct care versus indirect care per resident within the long-term care setting? And then similarly around the access to the multidisciplinary team, that, it shouldn't be up to each province and territory to think about all these different things. And that really we could achieve so much more if we do it at a national level. And then be transparent about it. So I think that should get publicly reported, so that for each of these indicators, that should actually be reported, as well as how much money goes from the federal government to the provinces and territories for this, and what's the return on the investment?
Yeah.
So, is it met? And if not, why not? So I think those are really, really important things. The other thing that, in terms of kind of the integration that needs to happen is, again, one of the things that was seen in the first wave of COVID was that in countries where there was a very close integration of their public health and of the different healthcare sectors, they tended to perform better. And so if you looked at countries like, Australia's not doing so well now, but they were doing well then, Slovenia and Austria, they all, at the very beginning of the outbreaks, their policies that they implemented were across the sector. So they didn't just focus on acute care, they focused on acute care, long-term care, the community, and the economic piece. So they did it all at once. And so it was a very much holistic approach to the policy side of things, as opposed to in Canada, where it was more fragmented. And so I think, again, it highlighted that we need to be thinking about these things from across the different sectors. And, again, now with what's going on in the education side of things, it highlights again that, how interconnected we are.
Yes.
So that, what happens in one sphere has a ripple effect in the other spheres. So kind of, so the fact that, what's going on in the, with back to school now, should not be a surprise, right?
Yeah. Should not be a surprise. But I guess lastly, in terms of with the report and the recommendations, what else do you think that, in that report that it indicates that we should be looking at and really should be a priority for us to really, one of the main things that we should really be looking at?
I think a few things. One is, I think we want to make sure that certainly in Ontario that that there is continued provincial support for the linkage of acute and long-term care to optimize the outbreak management and control, because I think that that's going to be key to getting through this next period. Equitable pay for the long-term care staff that's aligned with their acute care counterparts. Ongoing education for long-term care staff, but also mental health support, as I mentioned. I think that's a key thing. The appropriate staffing models and mix for long-term care, and really thinking about how it has to be tailored to the context. It's not going to be a one-size-fits-all. So it's understanding the residents and their needs and tailoring the mix and model to that. Thinking again about the multidisciplinary models of care and what works. Making sure that families are engaged and that they are active participants in all of these recommendations, and coming up with the quality indicators. And then finally, making sure that we do have the data to make sure that we're monitoring resident quality of life and the staff quality of work. We want to make sure that the staff are happy at work, that they're satisfied, that they're feeling supported, so that they have a high quality work experience. And so it's being able to make sure that we have the data to understand that, because it's only when we have that we can make any adjustments then.
Thank you. I really appreciate your time, Dr. Straus. Thank you so much.
No, my pleasure. Thank you.
You're welcome. Thank you for listening to today's show. And if you have any feedback or suggestions for this or any other episode, please contact us on our social media at Twitter at Family Councils and at Facebook, Family Councils Collaborative Alliance. Thank you so much and hope you enjoyed this episode.